Hello everyone, I welcome everyone at Caraford International Institute of Sciences and Business Studies. My name is NGOLOBE Luke, a lecturer at the institute, and I will be taking you through a course unit called Primary Health Care. So members, you get ready and we get started. I think primary health care is not a new term. It's not a vocabulary. This is something that has been actually talked about before, and people will continue talking about it, more especially in this professional. And without wasting much time, I would like to look at the definition, what primary health care stands for. Primary health care has been defined as essential health care. Essential health care based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community, and therefore participation and at the cost that the community and country can afford to maintain at every stage of their development, in the spirit of self-reliance and self-determination. That's how primary health care is defined. And in this definition, we have some of the keywords that we need to note. Words like essential, meaning that it's a necessity. It is something which must be done. And practical, hands-on activities. And it must be acceptable in the society. That is to say, the methods that actually are used here, they shouldn't be against anyone's culture. They should not violate the people's rights in the communities. It has to be uniform. Whichever is done in the community should be uniform, and it must address people's needs. Then you talk about the participation. Everyone has to be part of the project, and everyone has to be involved in the project. That's what I can say about that definition. Now remember, in primary health care, there are services that are really brought to people, or what primary health care aims at bringing to people. And one of the services have been listed as follows: health promotion. Primary, here it means, bullet number 1, here it means health promotion here primary health care aims at providing health services to all people. There should be equal health services. There should be equal access to health services. By doing that, you are promoting health in the communities. And how can this be done? This can be done by extension of health services near to the people. This by lobbying for health centers. We have like health centers, 3 health centers. For some of these health centers are being owned by NGOs. And this is the initiative, or this is the responsibility of the what? Of the PHC members to lobby for the community. For instance, now here we have a body at the sub-county level that is charged with PHC. Remember, PHC actually, it starts from the national level up to the what? To the grassroots. What do I mean if I talk about the grassroots? Here I'm meaning to the village level. Because the village health teams, some of the members actually, they represent what? The PHC, or what we call primary health care. We have bullet number 2, illness prevention. Under now illness prevention here, after now providing equal health services, you've provided equal health services to people, you have provided all the hospitals and everything. Now here actually we now first of all focus on the efforts made by the health experts within certain communities to make sure that people do not get ill, people do not fall sick. And how can this be done? This can be done by organizing education sessions, and to teach people how they can prevent some of the chronic diseases that can affect the communities. For instance, we can talk about how can you control the spread of cholera in a community, and this can be done by maintaining what? By maintaining hygiene and sanitation. He told them to keep the courtyards, to keep the compounds, to keep the areas around them, around their communities to be so clean. Every home at least should have a pit where they pour rubbish. And the people should be clean throughout the community so that they prevent these illnesses, the outbreak of these illnesses. Mostly these illnesses just come simply because of our poor cultures that we are accustomed to. When someone, after now visiting, like you visited the latrine or the toilet, let there at least be what? Be water and soap. After doing that, you wash your hands with soap to make sure that you kill the germs, to prevent illness. Bullet number 3, care of the sick. For instance, now here we have the sick people, the people who are really sick in the communities. They are there by down nowadays. There are so many. For example, we can name them. The victims of HIV/AIDS, talk about people suffering from sickle cells, people suffering from cancer, people suffering from all those other chronic diseases, just mentioned by a few. Now these people under primary health care, we need to make sure that these people are catered for. And how can these people be catered for? By providing medicine to them, by providing food to them, by providing education to them, by providing safe and clean water to them, and by also making sure that we provide shelter to them. Through doing that, we would have cared for the sick in the community. Advocacy. Here's a primary health care expert. We are advocates. We advocate for the rights of the people in the community, what they ought to get at a particular time. For instance, talk about engaging the government, engaging different stakeholders at different levels of the project. For instance, here's a primary health care expert. You can engage a certain agency, a certain NGO, that people, hey, here we have a community. We have a community, they have no any school. There is no any primary or secondary school in the community. And people are not going to school simply because they do not have any school located within their communities. And by doing this, you are trying to lobby so that these people get services nearer to them. You can also bring the government on board and tell them we need a health center so that these people access health equally like in other people. That is lobbying. We have vulnerable groups, the disadvantaged groups in the communities, where we have people with disabilities, where we have people, and we talk about people, the orphans, talk about, there are so many people who are disadvantaged in the communities. So you make sure that you bring them on board so that the government, NGOs, there are so many NGOs, can even bring it to the attention of the WHO, that is World Health Organization. We have UNICEF. We have there are a number of NGOs. Just mention but a few. So you make sure that you make the people's needs to be known to the either to the government or to the concerned NGOs, so that they come out with a solution. And that one cannot be done when we have no whistleblower. So as a PHC expert, you have to be a whistleblower in the community and love for the people's rights to make sure that they get equal services at one of the principles of PHC. We say it's equity, meaning that the resources must be equitably distributed, equitably accessed. There must be fairness in the distribution of the resources to all people in the communities. Then the last bullet here, we have community participation. Under community participation here now, we make sure that every person in the community is engaged in the project. You cannot just come from nowhere and start implementing a project without the consent of the community members. These are people that know the needs that are really pressing them. These are people that know the problems that are really pressing them, the problems that are pressing them. So you have to engage them from the beginning of the project, and that can be done through making interviews, the questionnaires, or you can do, or you can use a wedge method, whereby you approach members in the communities and you find out, you start asking. For instance, you've entered the community and you you start asking village A, what is really your major problem here? What is pressing you so moistly? Some of them, they will tell you, yesterday I did not eat. Yesterday I had nothing actually put in my stomach. Others will come here. HIV actually is what? Is very high here. The spread of HIV is very high. Others will say, here we are facing challenges with education. Our children are not going to school. So we shall embark on what the community members have told us. That's why it's very important to make sure that you include, you make them do what? Participate, because they know their what? Their challenge is more than you, an expert who is just visiting them for the first time. They'll be able to tell you the challenge B is affecting us, challenge A is affecting us, so that you see, after now they have told you all their challenges, after you have gathered the information, you have done what you call data collection, you come now and you try to weigh which side is overtaking the other. This one talked about famine. How many are they? This one talked about this a particular disease, maybe. And how many people that are being affected by this particular disease that was talked of. So here, we go with the majority to implement the project that is oppressing most of the people in the community. And now PHC here, we are going now to the next subheading, which is level of primary health care. PHC is practiced in levels. There is now level 1, or what we call primary health care, and that is level 1 according to me. And you can, I think even the notes are very clear. So be in position to see that level 1, primary health care. And this is the first level of contact between individual and the health system. This is now where we have the village health team accompanied by what? A primary health care expert who is centered within that what? Either sub-county or a parish. Because we understand these primary health care experts, they are at least within every sub-county in the country. That's where they're based. And that's where like you find them. So, here now, we have the village health team. They will come and they engage themselves with the people at the different levels, at different communities. They find out what is it that is oppressing you. Before we step in now for referrals, for going to the hospitals, we have to what? We have to intervene in the situation. The individual and the what? And the health system. And the health system, this time round we are saying the health systems are just located within our villages. After doing that, the essential primary care is provided. They will now start providing the aid that they can provide that is actually within their premises, within their capacities. For instance, some of these, the village health team, they're equipped with what? Tablets. Some of them, they give some simple medication, what called first aid to the people before they go for further medication. More especially during night, these are the first people that actually we approach, the first people we access and tell them exactly what we are facing. And under here, we see most of the challenges can be managed. We can manage these challenges before actually they become what? Before the situation worsens. Can be managed at the what? At the community level. If we start treatment before, if we start treatment earlier, we can what? We can handle these problems. And now this is where we need the participation of everyone, the consent of everyone, the consent of everyone in the community, to make sure that they come out and tell us what's oppressing them. And once we get to know what's oppressing them, we shall work on their what? On their problems. Here we need to be so close. We be so close to the people. We make sure that the services can be accessed by everyone in the community at all levels. And now here we are saying that the members here, they do not go direct to the hospital. We say the services are located within their premises, within their communities, the villages. They can access the health. They can access all the services that they need. Here services are provided by the primary health centers. Here people do not go to hospitals yet. We are just still now an individual interacting with the health system. That is the first the first level. The individual interacts with the health system. Now we go to the next level, which is secondary level. Under secondary health care here, now more complex problems are dealt with. Here now we talk of the curative services provided by the district hospitals, what we call the general hospitals. This is now the first referral level. In the districts, we normally call these are general hospitals for the district, whereby we refer people for treatment. After now engaging, an individual engaging with the system at primary level, now we are saying at secondary level, now we are referring these people to go for further medication, to go for advanced medication, to go for treatment at the general hospitals, or what we call the district referral hospitals. Meaning now this is now beyond primary. This is beyond now primary level, so it has gone at an advanced stage where now if it's the sickness, it's a bit complex, so complicated. So we send these people to the health experts. We send them to the doctors for further intervention, for further medication. We have tertiary level 3. We have tertiary health care. Under now tertiary here, this is where now we have super specialist care, which is provided by the regional central level institution. For instance, let's say you're coming from the eastern part of the country and you're in Bushamai district. The regional hospital is in Bali. So now, after now trying the district level and the hospitals in the district, and maybe the situation is still worsening, we refer you now to the regional level. If the region now again it's not also working, the only option now becomes the national centers, the national referral centers. Now for instance, here the national referral center we have, it's Mlago. You go to Mulago. Then here we provide training programs. We train people how to take charge of themselves. We train people in different activities, different programs. We make an alarm. We do what we call awareness raising, so that people are aware of their services, are aware where they can find the services. So we become the whistleblower. We blow the trumpet so that these people, next time, they should not come to you. No, they should just get up and they know where they are supposed to get a particular service. This now we are saying, after your departure, they should not again look for you. There should be a clear direction where the service can be got. Primary. Now let's look at the PHC principles and approaches. And we say the following principles. So we are going to see principle number 1, the bullet number 1. Well, we said the bullet number 1 is intersect all collaboration. There's community participation, appropriate technology, there's equity, there's focus on prevention and health promotion, there's decentralization. Let's now look at one by one. We start with intersect all collaboration. We intersect all collaboration. This is where we have different services join, they come together. They come together and collaborate for the good of the people. Let's say education and health sector. We talk about income implementation, income supplementation. Income supplementation. You talk about clean water, sanitation, improved housing. This is now becomes the what? Intersect or collaboration. It's a joint effort. You make sure that all the basic needs that the people, the community require, they are being met. Why is the intersect all collaboration important? After now combining all the services together, after combining different sectors together, after them coming as a joint unit, forming what we call a joint unit, and they come together as one, we are now saying, first of all, it saves the resources, because there is effective use of resources. So first of it improves the health of the population. To identify community needs together. Remember now, after these sectors, let me say the sector of education, the sector of health have come together. They have merged and have come together. They identify the community needs together with the people, which eases the implementation of the project. Which are the sectors that should collaborate? Here we are saying all the sectors involved in the development process, such as health, agriculture, education, information, transport, and communication, housing, and non-governmental organization. They should all collaborate to make sure that they provide good services. They provide equitable services to the community members. And once these all sectors come together, there is promotion in the services which is being provided to the community members. There's now homework here. Homework 1. Homework 1. What hinders the intersectoral collaboration? And the answer is lack of communication between different sectors. That is the first answer there, meaning that as you go through during your free time, you try to generate a number of answers that hinders intersectorial collaboration. And homework number 2. How can we promote intersectorial collaboration? Here we are saying by forming bodies from relevant agencies and elders at different levels, starting from the community. That is just what a few of the answers here. But I would urge you people, I would urge you academicians, during your free time, you make sure that you give more answers. Remember, it's a homework. Generate as many as you can, because there are so many answers here. Let's go to another principle of community involvement. Community involvement, stroke participation. And straight away we define what a community is. But a community has been defined, and ever since in your P3s, when you're still people at different levels, you define the community in different ways. But here is the definition. A community is a collection of people living together in some form of social organization and cohesion. In a bracket, the action or fact of forming a united whole. So let's stop. Its members share varying degrees of political, economic, social, and cultural characteristics, as well as interests and aspirations, including health. Now, community involvement. Community involvement is the process by which individuals and families assume responsibility for the community and develop the capacity to contribute to their health and the community's development. Here now the community members, what the definition is all about. The community members themselves, first of all, they take the initiative. Remember, we are the ones, for instance, if you are the community members, we are the ones that are being oppressed by a particular need. So it starts with us first before the other people come in. By the time the people, the experts come in, the PHC experts and experts from all different levels, the different bodies come on the ground, with the community members, we would have already played a big part of identifying what is exactly pressing us, what is real the major problem, the major challenge of the community, so that if the experts come, they put their money, they implement the right project that's going to meet all people's needs in a particular community. And we said the community should be actively involved in the assessment of the situation, problem identification, priority setting, and making decisions, sharing responsibility in the planning, implementing, monitoring, and evaluation. You see now here, these are the areas where we make that all the community members, we include them. We are trying to make the assessment. They must be part of the squad. They must be part of the team that is making assessment. Really to find out exactly needs that is pricing the community, that's pricing them. Problem identification. Those are first stages of a project. And there's no way you can start a project without involving the members that are being affected, or infected by the project. That's why if you're sent any community for data collection, you make sure that the data that's being captured, it's comprehensively captured. It does not leave anyone outside. Make sure that all the stakeholders, the community members, participate equally. Okay, let me home. The point is home. Priority setting and making decisions. What projects are we giving the priority? Remember, before I told you that in projects, the best way of actually collecting data is what we call using the awage method. You know the awage method? Now here, I will come, maybe house A, household A, household B. What could be the problem that is affecting you? What is the issue which is oppressing you here? You approach different people at different level and you ask them accordingly. What are challenges? What are they facing? Some of them, they're going to tell you, hey, here we have this, the others, they will say, feminine, others, they will come poverty, so that you implement a project that covers most of the people's needs in the community. That's what we are priority setting, and what making decisions. You make decisions basing on the number of people that are affected by that project. Now, sharing responsibilities in the planning. Here, all members must come on board. Yes, however much the organization, the NGO has come to help them, but they should not just sit and be spectators of what is taking place. They must be part and parcel of what is happening. And how can this be done? You know, at the community level, there are so many resources. There are resources that can be found within the community, and the community members themselves, they must be active. They must participate. That's what we said. We use appropriate technology. If the technology is not appropriate, there is no way these people are going to do what? They are going to be part of it, because it means now it's going to become complex for them. But here in appropriate, the services, we get these other resources from the local level, from stage 1. That's where we get the services. There are resources to be used in implementing a project. For instance, we are constructing hospitals, we are constructing schools. We can engage the members themselves to come out with bricks. We can engage the members to tell them, there are trees where you can help us with poles. And by doing that, we're trying to save the resources. I think the point is home there again. So we continue. Talk now appropriate technology. Here now, the cost of the service. We talk about the cost of the service. Capital and recurrent. Appropriate technology does not necessarily mean low cost. Efficiency and effectiveness in dealing with health problems. How effective, how efficient is the service in the health system? Yes, maybe you have brought certain medication at a certain community. How effective it is? Is everyone accessing the service? Is it bringing a positive impact to the community? If it's not doing that, then it's not effective, it's not efficient. But is it real enough for everyone in the community? Or it's just being given to a few people and the rest of the members are ignored or left out? Acceptability of the health approach to both target communities and health services and health service providers. Now here, the service you are bringing, is it against people's customs in the community? Remember, we said it must be acceptable. So bring a service which does not violate the rights, the cultures, the norms of the people in the what? In the community. In the community we have so many different people. You have people who believe in different religions. You have people who believe in different what? Cultures and norms. So we must address them accordingly, without segregating, without isolating anyone. Broader social and economic effects. How broad is the service? Is it covering everyone in the community? is the service which is being provided impacting people economically? That's what you should focus on. The service, the health must be what? Must cover everyone in the community, and it must impact all members economical in the different community. Sustainability. Here I talk about the capacity to maintain the equipment of the approach. Yes, you're bringing a certain project at the community level, but how are these community members going to sustain it? Can they sustain this project without you? Can they sustain it even after your departure? That's what we mean appropriate technology, meaning that is a technology which is flexible. Even without the experts, the community members themselves, if it's a borehole, there must be someone that can, if let me say the project is not working, there is some problem, there is a breakdown in the system, the community members themselves, they should have the capacity to what? To maintain it. Based on these points, all levels of the health system have to review their methods, equipment, and techniques. Criteria for appropriateness. To be appropriate, technology must be effective. It must work and fulfill its purpose. In the circumstances in which it needs to be used. Culturally acceptable and valuable, affordable, i.e. cost effective. I talked about already that. Locally sustainable. We should not be over-dependent on imported skills and supplies to its continuing function, maintenance, and repair. So I gave an example of a borehole. We, the community members ourselves, have to have the capacity to make sure that if there is a breakdown in the system, we have the capacity to maintain, to repair it. Possessive of an evolutionary capacity. Technology is highly appropriate if its introduction and acceptance can lead to further benefits. Environmentally accountable. The technology should be environmentally harmless at least minimally harmful. Here, the project that you bring into the community, it should not violate our nature. The ecological system should not be destroyed simply because we want a project to go on. As we are implementing a project, we should also bear in mind that the environment is conserved. We should not bring the project which destroys the environment. Measurable. The impact and performance of any technology need a proper and continuing evaluation. If it is to be widely recommended, here now we have to make an evaluation. We sit down and make assessment. Yeah, we started this project, but how is it impacting the community? What are the benefits? Are people's life changing? We need to sit and we measure. We sit down and we intervene how the project is what either affecting or affecting the people, the community members. You go to principle of equity. Principle of equity. Here now, in view of the magnitude of health problems, the inadequate, inequitable distribution of health resources between and within countries, and the belief that health is a fundamental human right and worldwide social goal. The conference called for a new approach to health and health care. This is to close the gap between the haves in quotes and the have-nots in quotes, which will help to achieve a more equitable distribution of health resources and attain a level of health for all the citizens of the world that will permit them to lead and live a socially and economically productive life. Universal coverage of the population with care provided according to the need is the call for equity. If all cannot be served, those most in need should have priority. Now here we sing, if all the people of the community cannot be served, at least those ones that are being oppressed by a particular need, they should be given a priority. They should be given the first chance. If the service that we're going to give the community is not enough, but at least let's target the people that really need it, so that we serve them first. Meaning that under this we should have equal health, equal access to health care, equal utilization of health care, equal access to health care according to the need, equal utilization of health care according to the need. Planning for equity is a PHC. Planning for equity in PHC requires the identification of groups that are currently disadvantaged in terms of health status, access to or utilization of services. Principle number 5. Focus on prevention and preventive. Focus on prevention and promotive health services. Health promotion relates to the importance of adopting, where possible, a promotive or preventive approach to health problems. Such an approach sees health as a positive attribute other than simply the absence of disease. One of the important tasks of the planner is to redress the ambulance in the allocation of resources to preventive and curative care, enhancing the role of resources available for prevention and promotion. And now, for instance, now in the community, we've talked about all those health centers, the general health centers, and what. We should always make sure that to prevent certain deaths to occur. For instance, we should have those health centers equipped with the ambulance. It's ever ready. If there is a sick person that is in critical condition, it's ever ready. It can go and pick that person, so that a life that would have been lost is what is secured. It's prevented. And we make sure that we promote the health, the services to the what? To this ambulance. I'm giving an example of the ambulance. Making that at least all the health centers are in touch, and the PHC centers are also in touch with the ambulance services. In case there is a victim that requires such attention, must be accorded to, must be attended on. They must attend to the person before the situation worsens. There we are focusing on prevention. There are so many activities that we can do under that prevention. As you may take your time during your free time and also meditate upon and list a number of them. We are having decentralization.